Welcome to Functional Fridays. I am Dr. Sherry Jacobs, a naturopathic doctor and certified nutrition specialist. I'm with Dr. Shannon Kennedy, internal medicine doctor. And today we wanted to talk about sex hormones, which are not just for sex. They have other functions in the body.
Absolutely.
What else do hormones do besides providing a good sexual health experience?
We're talking about testosterone, estrogen, progesterone, and their precursors DHEA and pregnenolone. That's a panel of hormones that we look at on a lot of our patients for various reasons. For the obvious reasons, when people come in complaining of low libido or loss of sexual function, we look at those hormones. But also when people come in with high cholesterol or high blood pressure or anxiety or depression or insomnia, just to name a few.
Brain fog.
We look at those hormones because, when we're very young, they're at these optimal levels. And then as we get older, and by older, I mean 30, 40, 50, everything else still seems like it's working right. And our memories are just not what they used to be. Or our muscle tone is just not what it used to be. Or for some reason, my doctor wants me to take a cholesterol medication and I don't want to. And so we're like, well, why are these things happening? And a lot of those functions are controlled by sex hormones, and as they gradually decline as we get older, we gradually experience these symptoms of aging. So we look at them and we try to optimize them, and in doing so, we can prevent disease.
I'm a big fan too of looking at hormones before you think you need to look at hormones, because our bodies are so different. So once you have symptoms, say you're starting to have perimenopausal, menopausal type symptoms, and then we run hormones at that time, we don't really know where your baseline hormones are. So sometimes it's nice when you feel like you are pretty healthy to get a good baseline hormone panel. So you can always go back and look at, this is my mid-30s, this is my late 30s, this is my early 40s, and have kind of a running list of what your hormones are doing. I think is smart too when we have that opportunity. Not many people want to come in when they're feeling healthy, but that would be ideal.
That would be so ideal because the normal for hormones are such a big variance, and it really, when we're younger, some people are testosterone dominant, some people are estrogen dominant, and they get used to feeling that way and they live well that way. And then as you get older and a different hormone takes over, you feel really off. And we can look at them and say, well, they're all normal, but they're not normal for you.
For you, exactly.
Yeah. So we want to know what your normal is, and then we want to help you maintain your normal. One other thing, bone health. I think that's something that we don't look at in people until they're in their 60s. We say, oh, well, your bones are thinning, but that is a process that has started. We know at least to the time you're in your 30s, your bones are starting to thin, and that's very hormone dependent as well. So tons of good reasons to look at hormones early in life.
Yes. Yeah. We love looking at hormones, and love getting good panels on hormones, good comprehensive panels. And I think something that is a little bit different that we do that I think is which you touched on briefly, is looking at those hormone precursors.
Yes.
So those are really important to kind of start at the top of the pathway there and see what comes down and trickles down to the bottom, and how your body does that conversion, I think, is really important in another perspective. And we can always give those endpoint hormones, but sometimes we want to just feed the tank, so to speak, and give some of the ones that are at the top to downstream and go where they need to go, either in conjunction with the downstream hormones, or sometimes we can do that more preventatively before we have to go to direct hormone therapy. So lots of fun options in the sex hormone world.
Right, and well,